likely. Like people that work regular jobs at companies, they typically give them health and dental insurance as a bonus to their work. Now, these companies, they negotiate for the absolute cheapest insurance that they could possibly find. Very few companies actually have good dental coverage. And the ones that do have good dental coverage just don't know that they have good dental coverage and don't realize that they're paying a lot more than they could be paying for dental insurance. Now, what I've covered right now, what I've just talked about, is a PPO insurance. And it's a lot more complicated than what I've described right there. But that's basically the gist of it. It's a coupon for some dental work. And the majority of the time, 1 or 2 procedures will wipe out your insurance, and then you'll be cash out of pocket just paying for insurance. Now, the other kind of dental insurance is HMO. HMO, DMO, it's got a couple other names. Managed care, it's called. HMO insurance is the absolute devil. It's the bane of all medical, dental, everything in the country right now. It's the most awful insurance imaginable. And I'm so sorry if you do have an HMO insurance, because there is exactly 0 HMO insurances that are good. Not a single one of them. They do not care about you. They do not care about anything but a couple of bucks in their pocket. The way HMO insurances work is that, first of all, you have to be assigned to an office. So you have to have a designated office that you go to, and you can't go anywhere else, or else you can't use the insurance. You have to switch your provider to a different office if you wanted to go to a different office. So that's not a big deal, but you have to go to an assigned office. Once you go to that assigned office, and the reason why it has to be assigned is because for each patient that is assigned to your office, the insurance pays the office somewhere between a couple of pennies to $3 a month per patient. And for this payment, this capitation payment it's called, if the patient shows up, the dentist needs to provide a series of services for free. So exams, cleanings, general like checkups and x-rays, everything is covered for free. And even fillings are a lot of times free for the patient. The problem with this is that the dentist also gets $0 for any of the procedures that are quote unquote free. And fillings are, just the overhead for a dental office to do a simple filling is maybe $100 minimum. The insurance reimburses the office. They don't actually reimburse anything. They make the cost for the filling somewhere in the vicinity of $0 to $10. And so if I'm going to spend $100 of my money to do a service for you for a $3 reimbursement, regardless of the capitation check, which is never enough, and in this case, it's usually more $0 than any dollars at all. They just assign patients to your office that give you a population of patients to take care of. What kind of service do you think you're going to get? If you go to a restaurant and you pay $3 for a $70 steak, you think they're going to give you a good steak? You think they're going to give you good service? You think they're going to care what you think? You think any of these things? No, you're not going to get good anything. Unfortunately, HMOs kind of rule the environment, or they don't rule it, but it's a big portion of the environment where I am. So I do accept a lot of HMO insurances. And unfortunately, these insurance companies take advantage of the doctors, and they know that the doctors don't want to do bad work. They want to do good work. And I treat everybody the same. Everybody, no matter if they're paying or not, they get the same. Oftentimes, I don't even know what the income is of the office per hour, so I don't even pay attention to that. I just do the best work I can, no matter what, because that's the only thing I can do. It's the only way I can do it. It's the only way I can go home and sleep at night. So they really do take advantage of this situation. And the only benefit to the doctor is that when the patient shows up, you get to charge them cash for uncovered procedures. So procedures that aren't covered, such as implants, which is why I do a lot of implants, or significant size dental, various things. It's hard to really just. It's a lot. It's a list of things that are covered and are not covered. Bone graft surgery, extractions are usually covered. Implants are not covered. Various types of crowns are not covered. Upgrades are not covered. Lots of things that are not covered. However, this covered and uncovered category is very, very gray. So here's something I'm going to leave it at that, but I'm going to point out one more instance for people that kind of sort of have an idea of what dentistry is. So I'll point this out more in a future video if people are really interested in it. So a dental filling is essentially, if you have a cavity, what we do is we essentially just cut out the cavity. The whole portion of the tooth that is cavitated or infected with bacteria, we just cut it out. Straight up just cut it out. and then we replace it with a material. It might be porcelain, might be some sort of a resin, might be some sort of a high-tech plastic material, it might be a glass ion, a series of materials we could use based on the situation to replace it with. But what we're doing is that or amalgam, metal fillings, a lot of East Coast people love metal fillings still for some reason. What we're doing is we're cutting a hole in a tooth that's whole and sound. We're just chopping a whole quarter off the tooth, and we're packing it with some crap and expecting the tooth to hold up. Now, the teeth grow in a very specific way, and they're very highly structurally engineered by nature to work the way that they do. And so the way we do things definitely is not helping the tooth stay together. Now, a crown kind of goes over the whole thing and sort of somewhat keeps things together, but a filling does not. The tooth does not get supported by a filling. It gets supported by itself. So when we cut these holes in teeth, it's not beneficial to the tooth. We're just trying to get rid of the diseased portion of the tooth so that we can keep the tooth healthy. Now, if I give you a bunch of straw sticks, you could build a hut. If I give you wood, you could build a hut. If I give you bricks, you could build a hut. If I give you pretty much anything, humans can figure out how to build a little enclosure for a house. If I give you a tooth that has a bunch of holes all over it, you can build a tooth. Now, which one's better? A house made of straw or a house made of bricks? Which one do you want to live in? So what we're essentially doing is building the tooth out of straw. And the gray area is that what the insurance will cover is the filling. And there is no instance in which I cannot repair a tooth with filling material or straw or brick or granite or whatever. I can always rebuild a tooth from nothing. Always, without exception. How long it will last? That's another story. The insurance doesn't care about that. That's not up to them. So what many offices end up doing, including my own office in many instances, is that we tell the patient, yes, we can restore this tooth with a filling. It's not recommended, but it will work. Your tooth might break and you might need to take it out and get an implant after, but it will work. And then we give them the cash fee for the crown, which is somewhere in the vicinity of $600 to $1,500, depending on the crown and whatnot and all these other doodads. And that's our way of managing this insurance system, and that's 100% legal under the insurance guidelines. That's normal. That's what offices do. That's totally acceptable because you can always restore a tooth with a filling. Now, if that doesn't sound shady to you, then I don't know what is, because that's just a load of crap. I don't want crap in my mouth because my insurance doesn't actually reimburse the doctor appropriately for the procedure that I actually need. Now, doing a crown in a dental office, really exposing a little bit too much information here, but doing a crown in a dental office, the actual cost of the crown is somewhere, the actual cost of the actual item, the crown itself, is somewhere in the vicinity of $100 to $400. It can even go up to $600 just for the actual product, the crown product. Now, the overhead of an office, of a dental office, just in general, can be anywhere from $200 to $3,000 an hour. That's the overhead. That's the cost to the owner of the office that they have to pay to keep the doors open, to keep the lights on, to keep things running. When you're using various materials and doing various surgeries and doing whatever you need to do, the overhead can be very, very high. Now, a crown is anywhere across the country. A crown is anywhere in the general range of $400, which is the absolute bare bottom garbage crown that you're going to get, all the way up to $3,000. And $3,000 is a little bit extravagant. And that's, in my opinion, more than you need to charge for a crown. But hey, I'd love to charge $3,000 for a crown. So I think about $1,200 to $1,500 is a very good customary fee for a crown. I think it's the correct price that doctors should be charging. And I think it's enough money to get the absolute premium crown that you can get from any doctor, regardless of where they are, what they're doing, what they're using. I think $1,200 to $1,500 is the good range of what you should be paying for a crown. If my cost is the bare minimum $400, do you really think I'm going to give a patient a crown for $150? Do you really think that's reasonable for me to? Should I, as a business owner, spend money to treat my patients if I'm not getting any benefit for it. Plus, I need to maintain that product and maintain that patient and make sure they have a good user experience and a good customer satisfaction rating and all that stuff, and manage my Yelp and make sure everything's all dandy. Do you really think I want to do that? No, I'm not going to do that. I'm sorry. I can't do free dentistry and make a living. Like, you don't make a living off free dentistry. It costs something. Now, I'm not saying I want to be a millionaire, but hey, it costs something. I did have to open the doors of my business. I did have to hire staff. I did have to do everything. And so what ends up happening is that patients get frustrated and just angry at offices when they're explained this stuff to them, and they give you bad reviews, and they just give you trouble. They just make problems for you. So it behooves dental offices to just not accept HMO insurances, or they just don't care about their Yelp reviews or any user experience or customer experience or anything, and just do nothing. Just do nothing, or just do the procedures that are valuable to them, or just watch everything. So a lot of the times HMO patients will come in and they just have horrendous teeth, just horrendously bad teeth, because they've been going to an HMO office that just doesn't maintain anything. And that's fine. They're treating it with toothpaste, they're treating it with flossing, with hygiene, with whatever. That's fine. That they can do that. However, in my opinion, I don't want teeth like that. I want my teeth to be healthy. They're also not explained how to improve things, how to get things better. So at the end of all this, the gist of this whole thing is that dental care, medical care, any kind of care costs something. Now, I'm not saying pay extravagant fees or they should be crazy high, but what insurance companies have been doing to just take advantage of the playing field, is just preposterously bad. And doctors are fighting back by doing their own shady crap, which I don't agree with, but I mean, you don't have a choice. Like, there isn't options. And a lot of these chain dental offices do this kind of crap just to make a buck, just to get that capitation check. Like I said from the beginning, if you have 3,000-4,000 patients assigned to your office, and here's where it comes full circle. If you have 3,000 or 4,000 patients assigned to your office, and you're getting $1 to $3 per patient, you're getting a pretty healthy capitation check. You're getting $4,000 to $10,000 a month of just free money for doing nothing, for just having these patients assigned to your office. And if they show up to your office, you get to charge them for procedures that are not covered, like implants, like upgrades to crowns, like various other things. Yes, you might sell them on a lot more stuff to try and make it more worth your while, because a lot of the times the basic stuff, which is pretty much what anybody needs, is 100% covered. But at the end of the day, out of 3,000 patients that are assigned to an office, like maybe 100 a month actually show up, like max. And so that's why dental offices maintain an HMO roster and HMO patients, because they're getting $3,000, $5,000, $10,000 a month, and that covers their rent, and that's really, really nice. And when the HMO patients show up, some offices, I unfortunately will say more offices than not, treat them differently. They treat them as not lesser people, but they just don't give them as much attention. They don't give them as much care. They don't talk to them as much. They just don't get the same of everything, depending on what office they go to. Now, I focus on surgery, and I focus on treatment that's essentially not covered by HMO insurances. And all the HMO patients generally know that me and my entity organization, we focus on higher level treatment that costs money that is not covered by their insurance, and that's how we maintain everything, and that's why we have a healthy HMO roster. And we do cover all the other little stuff as well. We do all that stuff for free for them, but we're doing it to get patient flow through our door, and that's the benefit to the doctor. But they still have to play all these stupid tricks to figure out how to make a buck out of these insurance companies, and the patients don't know the difference, because patients are just generally incredibly uneducated about everything. And even doctors, when I was working in a hospital, I had a little meeting for the plastic surgery group and the ENT groups, just explaining to them how dental insurance works, because it's so drastically different from medical insurance. And you're not taught any of this stuff in school. They don't even talk about it. They don't even tell you insurance exists in school. And they were genuinely outraged, because they say, "What are you talking about? I have my dental insurance through the hospital, and they cover me for sure, and they cover me at 50% on everything." Then when they went and checked their coverage, These are the highest level surgeons in the hospital. They had coverage at $500. The hospital literally would give them dental insurance free for them at coverage for 50% coverage, but only up to $500. That barely covers 2 cleanings a year and a couple of x-rays and exams. Like, that's essentially no coverage. And here's the other kicker. If you really wanted good dental insurance, just go to a dental office and find one that you really like and just pay them $15 a month, $20 a month. Just pay them, just straight up just pay the dental office $20 a month. I bet you they'll cover as long as you show up for your cleanings and appointments and visits and everything, I bet you they will give you free exams, drastically reduce cleaning fees, and reduce your fees on various higher price procedures because you've dedicated your loyalty to that office. And they love that. And we love having loyal patients that genuinely appreciate our work. And that's really what dentists want. They just want to be appreciated for the work that they do. It's really nice to do great work, and I love doing really pristine work. But majority of the time, the patients just don't know the difference. They don't care and they don't understand, so it just goes over their head, and you don't get any appreciation for it. And then they get angry at you also because whatever reason, they're sore from the injection, they have they had a little bit of discomfort, or the chair, they hurt their neck for the 12 minutes that they were sitting in the chair while I did so much work in their mouth. And that's just the way it is. I've gone on my rant way too long at this point. I made it a separate video, so I actually want to see if people actually watch this separate video. If you are interested in more dentistry, if you have more questions, ask anything you like in the description below, and floss your teeth.